Good morning, good afternoon, good evening. My name is Rich Clark and I've been a hypnotherapist for the last 8 to 9 years, and I've been a holistic therapist for the last 14 to 15 years. So I talk about fears and phobias every week, and usually I used to share them on Fridays, but now I just do them as ad hoc. So as I've been talking about marriage and I've been talking about relationships, I'm going to talk about that next week to do to Valentine's Day. I'm going to talk about the fear of pregnancy, which actually occurs and comes up in a lot of marriages. Now, this is actually out of the fears and phobias, the top 100 in the world. This is number 72. So the fear of pregnancy, called Tokophobia, is the fear of pregnancy or childbirth, and the word is derived from the Greek tokos, meaning childbirth, and phobos, which is intense fear or dread for a situation or an object. Other names have been called Tokophobia, Enfantaphobia, and Parturiphobia. So there's actually 4 different names for the fear of pregnancy. Now, the British Journal of Psychiatry has first documented this phobia only a decade ago. So the fear of pregnancy was actually not spoken about very much in holistic fields or psychotherapy at all. And prior to this, there was very little knowledge about this issue, and it received very little attention than it deserved. Actor Helen Mirren actually confessed being a tokophobe after watching a film about childbirth that so disgusted her she was put off having children and never wanted to have anything to do with children. So if you know who Helen Mirren is, that's a very famous actress, and she doesn't have children. So the causes of tokophobia is this. Tokophobia can be secondary or primary, and its meaning it can stem from prior bad experience or postpartum post-traumatic stress disorders, or it can happen to women who have not given birth previously. So it can be women who haven't given birth, or women who have given birth, had such a traumatic pregnancy that they don't want to give birth again. And this is where some people then have sometimes gone into surrogates, and some people have done cesarean instead of natural birth, and so forth. So most common causes of primary type of this fear of pregnancy include history of sexual trauma, abuse, rape, termination of a pregnancy, a miscarriage, abortion, or negative episodes relating to the overwhelming pain of a bad hospital experience. So news reports and stories about women, particularly one's own mother, suffering from intense pain or even dying during vaginal childbirth can lead to fear of pregnancy in young first-time-to-be mothers. Often, experienced mothers love to exaggerate the horrors they suffered during their labour to first-time pregnant women, not realising it is not the right thing to do. It is very discouraging. And what we should do is everybody's pregnancy is so different. From a personal experience, I have spoken to my mum who had a very traumatic pregnancy with myself, and she didn't have any more children because they decided to go through the natural birth route, but they should have done a cesarean, and they caused many problems for my mum. So I've been experienced and know what women can go through in that way firsthand, but also seen over time when my mum had to have hysterectomy and so forth. So there's a lot of things with the fear of pregnancy is not discussed, and it's something I thought was an important topic to talk about today, especially included within marriage. So to this extent, the fear of giving birth is normal. After all, it's an event that most women experience only a few times in their life. But for tokophobia individuals, this could mean a lifetime of fear giving birth and having children that make them delay or put off pregnancy. So the symptoms of the fear of pregnancy is nearly 6 to 7% of women suffer from this fear of pregnancy. However, most do not talk about their fear, until it's too late in the term. Then they try to opt for cesarean deliveries, but many obstetricians are not understanding or sensitive about their situation. This leads to huge anxiety for the mother. If you notice, most obstetricians are men. So when men are talking about the pregnancy or the worries of pregnancy, when they've never experienced that, in the biological format, then it's very much how, with a woman's experienced pregnancy or has been a mother, they're going to know a bit more. It's an interesting sort of field, really. So with women suffering from the fear of pregnancy phobia are often mistaken as being melodramatic or overacting. So, however, the sufferer experiences intense trauma stemming from the phobia, nightmares, sweating, the fear of death, which happens quite a lot. And we know that through another one of my series, I talk about the fear of death as a phobia. At the thought of giving birth often led the individual to put off pregnancy forever, opt for elective cesarean, or continually suffer from psychosomatic complaints. So many women, especially with this morbid fear of pregnancy, has been known to terminate their pregnancy midway because they are too scared to continue with it. Some women are not even aware of the phobia until they approach delivery. This is when they start having recurrent nightmares about the impeding childbirth. And the psychological and physical symptoms of this are depending on the very intensity of the phobia. So some of these are the actual things that will come up when people have this. Increased heart rate, rapid breathing, panic and anxiety attacks, nightmares, sweating and trembling, crying, shaking, getting hysterical, having thoughts of death and dying. Some of these are also vomiting and nausea at the thought of something alive and growing inside one's body. Some tokophobes start crying by just seeing a pregnant woman on the street or even hearing the word delivery. So how do we overcome this fear of pregnancy? Well, in the medical world, most people would do antidepressants and psychotherapeutic counselling, the most common methods of overcoming it. Talking about one's fear of pregnancy is also known to help women overcome to an extent. However, most are embarrassed and refuse to discuss it, and this is where online and offline forums are a great place to give vent to such thoughts. Now, as I'm a hypnotherapist and CBT therapist, cognitive behaviour therapy and hypnotherapy, as well as EMDR, which is eye movement desensitization reprocessing, which I don't do, but however the other two I do, are few forms of overcoming tokophobia. And it's also known with CBT and hypnotherapy is we use it as a very advanced, just not in the beginnings of pregnancy, but in the advanced stage of pregnancy, because it helps reduce the intense fear of pregnancy by processing previous traumatic memories associated with the phobia. Now, in clients I have had who've had a fear of pregnancy, it is when that's actually, I first learned about it, because I used to do reflexology. I used to do fertility reflexology and pregnancy reflexology and pregnancy massage. So I used to work with a lot of pregnant women in spas and to go to people's houses. I did this for about 2-3 years as part of my work as a holistic therapist. So working with people, I learned a lot about their issues. And with hypnotherapy, we worked out why they had issues. So a lot of them, I would say about 70% of them had a traumatic birth where they experienced as a baby with their own mother, was one of their fears. Some, whether you believe this or not, had past life regression, they had these issues. And then with some people, it was just through things they'd seen or they had just witnessed or knew other people who had bad experiences of pregnancy. So all these things, I've worked with and got a lot of experience with, and I've worked with that with the fertility issues, which I will talk about as of next week with Valentine's Day as well. So, because I think it's all interrelated. So anyway, if you are interested in, or you have a fear of pregnancy, or you have a fear of within your marriage, or you fear of pregnancy or fear of marriage because you don't want to be pregnant, or in your relationship, or so forth, please don't hesitate to contact me. You can message me on any of the platforms this video is on. I am actually at the moment getting my website rebuilt. So unfortunately, there is a way of contacting me on that website. However, at the present moment, it would probably be best to message me on the platforms such as YouTube, LinkedIn, Instagram, and Facebook.